In the 1990s, healthcare reforms led to hospital and university cutbacks. But the creation of the Alternative Funding Plan with the Government of Alberta gave the department stability and opened the door to renewed recruitment.
The idea was, well, we needed to find a way to get the money to develop a robust academic department and an alternative funding plan, wherein the department members are funded for a day or two per week for their academic activities. That was a new concept in Alberta. Over the 5 years, over 75 new academic faculty were recruited. The number of grants that were submitted for funding increased, as did the number of teaching hours and the number of publications. Those are the objective measures.
In the early 2000s, medical scholarship flourished in all areas of academic medicine. By 2016, funding agency changes led to funding uncertainty. The new Academic Alternative Relationship Plan cushioned the department from the worst of the economic punches. Innovation persevered with the launch of quality improvement initiatives in clinical care and the transition of training programs to competence by design. In 2020, COVID-19 brought the world to a halt, but not in hospital wards. Department members gave their all to clinical care during the pandemic, and through it all, they participated fully in the implementation of Connect Care, the provincial electronic medical system in Alberta hospitals.
Paul Armstrong said to me that I should go and research career development and present something to the department. After that, we had a career development program, and part of that was a mentorship program. Gender equity was coming on the horizon as an issue, and so it was important that we had women who could mentor women to progress in their career, and that's how it started.
There was a more general curricular reform that took place in the early 2000s led by David Cook, and I was a major part of that. And we were given the opportunity under Lauren Terrell, who was dean at that time, to make that the fundamental basis of the curriculum for the first 2 years of medical school. So we redesigned the curriculum based upon what we'd learned from the courses that I was piloting in the years just before that.
When the pandemic came, I think we were pretty ready to be able to go virtual for many, many things. That's one thing I really noticed, is how much our work has been shaped by the changes in the electronic systems. The other thing that is changing quite dramatically is a shift from more biological research to applied healthcare research. It's become a very, very important component of what a Department of Medicine does. And then finally, the other thing I really noticed was the increasing influence that women were having in the Department of Medicine.
In 2024, the department is embracing its second century. Uncertainties exist as they always have, but the achievements of the Department of Medicine are a strong foundation for the possibilities of the future and an inspiration for the way ahead.